Humeral fracture Sarmiento splint. It is to immobilize humerus after a fracture to allow full range of motion in joints involved in injured extremity. It also provides support to a body part without crossing any joints and provides protection. It allows movement to distal parts and also it prevents edema and stiffness. So for the next slide is So by applying the humeral fracture Sarmiento splint, you need to apply a splint with padding under the axilla, wrap it from medial to lateral and over the shoulder, except for the distal fractures, and then secure it in a place with an elastic bandage that should not be too tight. So for the sugar tongue splint, immobilize proximal radial fracture, immobilize the body part or the joint sufficiently to promote healing while also optimizing function. It also has a circumferential design to hold healing bony parts in alignment, and it also permits motion of the elbow, forearm, and hand, which helps decrease the development of edema and resultant joint stiffness. So this is the example of sugar tongue splint. So sugar tongue splint should hold the patient's elbow at 90 degrees of flexion. So the forearm is in neutral rotation and the wrist in neutral flexion or extension. And then the patient's elbow, forearm, and wrist should be splinted in different positions only at the direction of an orthopedist. So for the hand-based proximal IP extension splint, it is a dynamic traction, offers traction to a joint, although allowing controlled motion splint for an intra-articular fracture, which also gives constant longitudinal traction although the joint is gently moved. Hand-based proximal interphalangeal extension splint with low profile outrigger placing dynamic traction on the digit while allowing for passive range of motion. So this is the example of hand-based prox IP extension splint. So for the static progressive pronation supination splint, it is used to increase motion in the forearm. The goal is to immobilize as few joints as feasible. Also, the forearm pronation supination splints with both dynamic and static feature are helpful in regaining motion after fractures of the radius and ulna. So this is the example for the static progressive pronation supination splint. So for the swan neck splint, it is an oval 8 product of 3-point products. Note that the deformity is reduced, static motion blocking, and it also permits motion in one direction but blocks motion in another. And a swan neck splint is designed to allow flexion but block hyperextension of the PIP joint. So in other words, by looking at the picture, it is a bending in flexion of the base of the finger and a straightening out, which is extension of the middle joint, and a bending in flexion of the outermost joint. So next is the ulnar deviation splint for our ulnar drift. So this can be fixed by applying ice to the joints, can help reduce pain and swelling. So in more severe cases, like transcutaneous nerve stimulation, which uses electricity to treat pain, may also help reduce the pain associated with ulnar deviation.
So first one is the boutonniere splint. It is for extension of your PIP. We all know that boutonniere is a deformity of your hand or specifically your fingers that leads to hyperflexion of your PIP joint and hyperextension of your DIP joint. So we use this splint to prevent more damage in your hand. Next is the serial static prefabricated hinge PIP splint. It is a static splint that is periodically changed to alter the joint angle, and these splints are applied with the tissue at its near maximum length. It also provides a prolonged gentle stretch to involved structures, helping stiff joint regain motion. The next one is the hand-based spica. It is used for gamekeepers, thumb, or mga players ng soccer, specifically yung mga goalkeepers. And also, it helps the ulnar collateral ligament rest para makapaglaro ulit sila. Next is the finger sprain. This is used to immobilize the finger in neutral position, specifically if yung fingers natin is galing ng sprain or overused na yung ating ligaments sa fingers natin. So we use this to immobilize the fingers and have it at rest. The next one is the post-operative splint. It is for the patient with an extensor tendon pollicis longus repair. Injuries to the thumb flexor or extensor tendons require more specific splinting and depend on the level of the injury. Next is the metacarpophalangeal arthroplasty post-operative splint. The positions of the fingers in extension with slight radial pull. And post-operative joint replacements for the PIP-DIP or MCP joints of the hand require specific splints that promote healing or encapsulation of the joints while preserving ROM during the healing phases. For extensor tendon splint, this is used for post-operative care, allowing protected motion during the healing phase. Such as splint permits active flexion of the MCP joints within the constraints of the splint to an angle of approximately 30 degrees. For Indiana protocol splint, adds a tenodesis type action splint to the Kleinert componentry for specific active assisted range of motion exercises. And it can be used only if a specific surgical structure technique has been used. Next is the Kleinert splint. It is for post-operative care for patients with flexor tendon injury and allow passive flexion holding digit at flexed wrist. Also, it features dynamic traction into flexion but allows active digit extension within the constraints of the splint. Next one is the Duran flexor tendon repair splint. Positions the wrist and MCP joints into flexion and the IP joints into extension. And the last one is the extrinsic extensor stretching splint. It is to increase finger flexion in combination with increasing increments of wrist flexion. And dynamic finger flexion splints for stiffness after crush injuries to the hand. And the next slide is the picture of the extrinsic extensor stretching splint.
So this is the extrinsic extensor stretching splint. Joint jack, a static progressive splint used to increase extension in the proximal interphalangeal joint or PIP joint. Cinched straps and splints for PIP and DIP joint contractures with the merit components. It has metal finger bed, cotton felt, and padded screw tightens to increase tension on the finger joint. Resting hand splint. Hand and wrist are positioned to keep the metacarpophalangeal joints flexed and interphalangeal joint extended with the wrist in slight extension. Safe or intrinsic clasp position. Place MCP collateral ligaments on maximum stretch. Oppose the development of a claw hand deformity. Facilitates the weaker intrinsic motions of MCP flexion and IP extension that are difficult to obtain. Precautions. If your splint has outrigger or movable parts, it is important that there is a steady pull. Hand-based static thumb splint. Protect healing structures, decrease or prevent deformity, and reduce tone in spastic muscle. IP joint included for immobilization of distal phalanx. Provide prolonged gentle stretch to involve structures, helping stiff joint regain motion. Indications: MCP arthritis, chronic thumb basal joint arthritis, RA, and thumb sprain. Ball antispasticity splint to maintain hand and fingers in reflex inhibiting position and wrist in neutral position to reduce spasticity. It consists of moldable low-temperature thermoplastic and straps are included. The splint is indication to help prevent deformity in the presence of mild to moderate hypertonicity and may be used the following: CVA, TBI, and Parkinson's disease. Resting hand splint for SCI. With SCI or spinal cord injury at the C1 to C3 level, the goal is to prevent contractures and to hold the wrist and digits in a position of function with a resting hand splint. After SCI, your hands may be weak or unable to move. This splint will help your hands be in a natural position. Advantages: it will support the wrist and joints of your fingers and thumb in correct position, and it can help reduce pain, swelling, and stiffness in the wrist and fingers.
Shoulder sling is used for cases such as dislocated or fractured arm or shoulder. It restricts active motion of the shoulder, which places the humerus in adduction and internal rotation and the elbow in flexion. It unloads the weight of the arm on the shoulder, but it does not approximate the humeral head back into the glenoid fossa. It is used to correct subluxation completely. A sling should not create new problems such as edema in the hand. Mobile arm support is used for patients who has proximal muscle weakness, which is caused by cases such as myopathy or muscular dystrophy. It is used for wheelchair to balance forearm orthosis. Mobile arm support is not appropriate for wheelchair users but is indicated for patients with C4 level SCI. Wrist-driven prehension orthosis is used for patients with C6 level SCI. When wrist is extended, it causes flexion of the fingers. It is also called your tenodesis grasp. This orthosis is used to improve grip upon wrist extension. Utensil holder is used for patients with C6 to C7 level SCI. It promotes active elbow flexion and makes eating easier for the patient. Orthosis for SCI. For C1 to C3 level SCI, resting hand splint is used for prevention of contractures. For C4 level SCI, balanced forearm orthosis is used while using a wheelchair. This orthosis needs the use of available shoulder strength and the use of muscles of the wrist, especially the extensor muscles, to drive the fingers together into a grasping motion. For C5 level SCI, long opponent splint is used. It places the wrist in slight extension, it provides web spacing, and limits flexion of wrist and fingers. For C6 level SCI, the nodosus splint is used. It places the wrist in extension, causing fingers to flex. For C7 SCI, short opponent splint is used to provide web space. Ball splint orthosis is used to reduce tone in children with spastic cerebral palsy. It is used to reduce the tightness of the fingers. The ball helps to position the fingers so they stay open. It prevents finger flexion convulsion and joint deformation. Soft Benic is used for pedia patients. It positions the thumb away from the palm. Custom pediatric Muenster splint allows injured tissues and structures to heal without overstretching or shortening the tissue length. It restricts forearm rotation and wrist motion after reconstruction while allowing motion at the elbow. Gel shell splint is ideal for post-op use. The splint has a firmer outer fabric to protect the insertion site, while the inner pad provides light pressure on the incision site. The pressure applied on the site of the surgery prevents hypertrophic scarring and helps desensitize the wound. Airplane splint is used for patients who are suffering from a burn at the shoulder area. It places the arm in abduction. For burn patients, there is what you call rule of nines. For your head and neck, it is 9%, 4.5% anteriorly, and 4.5% posteriorly. For the trunk, it's 18% anteriorly and 18% posteriorly. For the arms, it's 9% each side, 4.5% anteriorly, and 4.5% posteriorly. For your legs, it's 18% each side, 9% anteriorly, and 9% posteriorly. While for your genitalia and perineum, it's 1%. For the resting hand splint in burn, MCP is positioned in 70 to 80 degrees flexion, wrist is in slight flexion, IP joint is in extension, and thumb is in opposition.